Why is seborrheic dermatitis more common with Parkinson's disease? Imagine a skin condition that seems to pop up more often in people with certain neurological issues. That's what happens with seborrheic dermatitis and Parkinson's disease. It's a common question. Why do so many Parkinson's patients develop this skin problem? Let's explore the facts together. Seborrheic dermatitis is a type of eczema that causes red, flaky, and greasy patches on the skin. It usually affects oily areas like the scalp, face, and chest. In people with Parkinson's disease, the rates of seborrheic dermatitis are much higher, sometimes affecting nearly 60% of patients. That's a big jump from the general population, where it's much less common. One reason for this link involves the nervous system. Parkinson's disease causes a loss of dopamine-producing neurons in the brain. Dopamine is not only important for movement but also influences the autonomic nervous system, which controls things like oil production in the skin. Some early ideas suggested that Parkinson's might increase oil secretion, but later studies showed that this isn't always the case. Still, some men with Parkinson's might produce more oil, which can feed the growth of fungi like Malassezia. This fungus thrives on oily skin and can trigger inflammation, making seborrheic dermatitis worse. Another factor is how Parkinson's affects facial movements. As the disease progresses, patients often have less facial expression and fewer muscle movements. This reduced activity means the skin doesn't get naturally cleaned as well, allowing oil, dead skin cells, and fungi to build up. This buildup creates a perfect environment for seborrheic dermatitis to develop. The disease also impacts the autonomic nervous system, which controls involuntary functions like sweating and oil secretion. When this system doesn't work properly, it can cause skin changes that favor seborrheic dermatitis. Interestingly, some research suggests that skin issues like seborrheic dermatitis can appear before the motor symptoms of Parkinson's, acting as an early warning sign. Age and how long someone has had Parkinson's also matter. Older patients and those with longer disease durations tend to have more skin problems, including seborrheic dermatitis. Over time, the neurological and skin changes accumulate, making the condition more likely. In essence, the higher occurrence of seborrheic dermatitis in Parkinson's patients comes down to a mix of reduced facial movement, nerve system dysfunction, and fungal overgrowth. Managing it involves gentle skin care, like using mild cleansers, and treatments that target fungi and inflammation. Understanding this connection helps doctors better care for patients, improving their skin health along with their overall well-being.